I'm always surprised to hear how many people think dentures is just a normal part of aging. Wow, you're 60 years old and you still have your natural teeth? Really impressive, man. No, this is totally normal. You should have your teeth for your whole life. It is not normal to end up in dentures. And the truth is, you might even start to lose your teeth even sooner than you might think. And that's even if your smile looks pretty in those pictures. As a dentist, it always kills me when I see patients in their 30s and 40s and sometimes even in their 20s that end up in complete dentures because they just neglected their teeth and they ended up having to get everything removed. And it's usually not because of genetics. As much as people want to say it, it's usually because of bad habits. Now, can it be because of genetics that cause weaker teeth? Yes, but it's really rare. So in this video, I'm going to break down exactly what not to do if you want to keep your natural teeth for life. And trust me, you want to keep your natural teeth, because even the people that I talk to that end up in dentures and they say, oh, I already know I'm going to end up in dentures and that's what I want, blah, 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 they hate it. Everybody hates it. Everybody wishes they had their natural teeth. I don't know a single person that loves their dentures. If you could have your natural teeth, it's gonna be way better. Okay, so I wrote down like 7 of the top mistakes that are basically gonna damage your teeth or damage your gums and can eventually lead to you getting dentures. So number 1 is drugs. Number 2 is skipping your deep cleanings. Number 3 is ignoring your bleeding gums. Number 4 is using your teeth as tools. Number 5 is snacking. We're gonna get into detail on that. Number 6 is grinding and clenching. And number 7 is skipping the dentist altogether. So let's start with number 1. I know I'm starting off with a big one here, but drugs, we gotta talk about it. There is literally a term in dentistry called meth mouth. And that's basically where all your teeth are severely decayed and damaged, and most often you need to end up losing all of your teeth. And that's because drugs like meth can cause severe cavities and wearing down of your teeth, and also cause a ton of inflammation in your mouth. And it's not just hardcore drugs like that. Even things like Adderall can cause you to start grinding and clenching your teeth, which we're gonna talk about in a bit, but obviously that can wear down your teeth more too. Now, I'm assuming most people watching this video don't really need to hear this talk, so I'm not gonna talk about it too much. But I did also wanna talk about just numbing dental pain, because some people, they're not like drug addicts or anything like that, but they'll take like ibuprofen and like Tylenol just to help with their tooth pain because they think their tooth pain is normal, then they'll avoid going to the dentist. Any type of tooth pain is definitely not normal, and it's actually a sign that something has gotten really bad, because even like minor dental problems like cavities or other issues usually don't hurt. You usually don't even feel a cavity starting. Dental problems usually don't hurt until they've gotten really bad. Like if a cavity gets really big and it gets close to the nerve, or if you like fracture a tooth or something, this is when you start to have some pain. And you might not even realize that your tooth is cracked. It could be down to your root or something like that. So if you have dental pain, it's definitely important to get it checked out. All right, mistake number 2 is skipping a deep cleaning. Now, what exactly is a deep cleaning? Well, yes, there are different types of cleanings at the dentist. You can get a regular cleaning or a deep cleaning. Now, technically, there are different types within those, like within the regular cleaning and within the deep cleaning too, but just to keep it simple, there is a regular cleaning and a deep cleaning. How do we determine who needs what? Well, a healthy patient will need a regular cleaning. If your mouth is unhealthy, then you need a deep cleaning. An unhealthy mouth is when there's a ton of inflammation in the mouth, you're starting to get bone loss because your gum disease has gotten so bad, and you have deeper pockets. So, you know when you get to the dentist and they start measuring your gums and they start shouting out these numbers like 3, 4, 5, whatever, those higher numbers like 4s and 5s and beyond are signs that you have a lot of bone loss and severe, not just gum disease, but now periodontal disease. Periodontal disease is when gum disease gets worse and starts affecting the bones and the gums that surround the teeth. So when you have an unhealthy mouth like this, you actually have to clean underneath the gums, and that's why it's called a deep cleaning, because you're not just going at the surface level, you're actually going deep below the gums. So it's not like a deep cleaning is better than a regular cleaning, like, oh, I want to get the thorough cleaning in my mouth. It's not like a deep cleaning in your house. It's more like, what exactly do you need to fix your mouth? Because if you're a healthy patient, you don't need a deep cleaning. There's nothing deep to clean. But if you're an unhealthy patient, you can't just get a regular cleaning, because you can clean at the surface, but that tartar and that bacteria are still going to be below the gums, and they're still going to cause more inflammation, and it's not really going to fix anything to clean from the top. It might look more pretty because you don't see that tartar and gunk anymore, but all that inflammation is still going on underneath. And this is actually the #1 reason that people end up in dentures. Not because of specifically skipping the deep cleaning, but Because people have severe periodontal disease. What happens is this gum disease keeps getting worse and more of your bone gets pulled away, and eventually your teeth get so loose that they can't even hang around in your mouth anymore, so you have to get them all taken out. Or you have so much bone loss and inflammation that they start causing infections and other problems, so you have to get them out anyway. Now I know that some people think that deep cleanings are a scam, or that your dentist is just trying to make more money by billing out a deep cleaning as opposed to a regular cleaning. Well, I totally understand that, and this is a big problem because there are some offices that do bill out deep cleanings when it just should be a regular cleaning. So it definitely happens. I don't want to ignore it, but I don't think it's as often as people think. So you got to make sure that you're going to an office that you trust. And if someone tells you need a deep cleaning and you don't trust it, just get a second opinion. What you don't want to do is just ignore it and assume that that person is lying to you. Like, why are you going to the dentist if you don't trust their opinion? Go to someone that you trust. Okay, number 3 kind of goes on with what I talked about before. It's ignoring bleeding gums. Bleeding gums are never normal. It's never normal to have your gums bleed, whether you're brushing or flossing or whatever. Now, if you get punched in the face, that's one thing, but if you're just doing the regular things, then yes, it's not normal. Bleeding gums is a sign of inflammation, and we talked about inflammation before, but inflammation in the mouth is really bad. It's a sign of gum disease. Now, typically, if your gums are bleeding just a little bit, it could be just a sign of like early stage gum disease called gingivitis. The difference between gingivitis and periodontitis, like I talked about before, is gingivitis just affects the gums, and it's 100% reversible. But periodontitis starts affecting the bones and the support structures around the teeth. Once you have periodontitis, you start losing that bone and you can never get it back. And again, that periodontitis is the #1 cause of getting dentures. So this is why if you have like an early stage gum disease like gingivitis, it's really important to correct it early on so it doesn't get worse. So what does it mean when you have bleeding gums? It means that you need to clean your teeth better. You need to keep brushing and you need to start flossing in between your teeth. If you're doing that consistently for like 2 weeks and you still have bleeding gums, then you might want to get it checked out because there could be something else going on. All right, on to mistake number 4, which is using your teeth as tools. This one's pretty self-explanatory. Your teeth are not meant to open objects. They're not meant to hold on to your fork. They're not meant to open bottles or any of that stuff, because the more wear you put on your teeth, the more that they're at risk of fracturing. Now, this might not break all your teeth at once, but if you're using your teeth like this, then you're gonna keep putting stress on the teeth. You might think in your 20s, like, oh, my teeth are totally fine, but what's gonna happen when you're 50 or 60 or 70? A lot of times people end up cracking their tooth when they're eating like a tortilla chip or something really minor, and they think, huh, that's so weird that such a simple thing cracked my tooth when I was cracking a bottle open with it last week. But really, it's the constant use on our teeth that will eventually crack and break our teeth. And a lot of times a crack can be kind of like a micro fracture in our tooth, and it can go undiagnosed for a long time until it just takes one simple thing to put the nail in the coffin and actually break our teeth. So bottom line is, just use your teeth the way they were intended to, just to eat your food. And mistake number 5 is snacking. Now, I'm not saying that you should never snack on food. What I'm saying is snacking on carbohydrates really is what can cause a lot of cavities. So when it comes to cavities, the biggest problem is the frequency that we're introducing these foods into our mouth. Anytime we eat anything, we're making our mouth more acidic. Number 1, our mouth hates acid. And the second problem is if we're snacking on fermentable carbs or any starchy foods, then these will do just as much damage to our teeth as candy. And that's because the bacteria in our mouth called Streptococcus mutans will eat these carbohydrates, and in turn they will poop out acid. So whether these carbohydrates are like sugar or like a bag of potato chips, both of these will do the same thing in our mouth. And this is where the frequency matters, because if you just have like a snack at one point in the day, no big deal. But if you have it constantly throughout the day, like if you have one bag of potato chips, for example, and you just start snacking on that throughout the day, and you finish that bag, just that one bag, but it took you all day to finish that bag, versus if you had that bag just in one sitting or like within a point of like 30 minutes, it will do a lot more damage when you have that bag throughout the day. Because anytime you just put a single potato chip in your mouth or take a single sip of your Coke, or whatever it is that's acidic and sugary, then you're introducing those acids and you're introducing that sugar into your mouth that's gonna keep feeding that bacteria, which is gonna keep pooping out more acids. And if you keep doing it throughout the day, then you're gonna keep doing this over and over and over. Versus if you just do it in one sitting, then the benefit here is you give your body time, you give your saliva time to build up and kind of clear out all these acids and all these bacteria and kind of neutralize everything. But if you keep doing it, then you don't give your saliva time to build up and nothing is getting neutralized, and then you can start to get these weaker teeth over the years. This isn't just something that happens over like one night or 1 week. This happens like over years. So if you're doing this a lot, like I see this happen a lot of times when people go to college, like they have like all this free reign when they see the cafeteria. So they start drinking soda and like habitually start like snacking on stuff all the time. Then they come to me and I'm like, dude, where did you get all these cavities from? And you gotta remember, in dentistry, nothing lasts forever. So if you get like a few fillings, eventually those fillings might fail, because nothing is going to be as good as your natural tooth structure. And then anytime you have to get that filling replaced, you're going to end up removing more tooth structure. And eventually that tooth might need like a crown, and then it might need like a root canal, and then that root canal might fail, and then you might need an implant. But you can see how if you really neglect things, it can turn into a condition where you end up getting dentures. All right, so number 6 is grinding your teeth. Now specifically, the mistake here would be ignoring grinding. So a lot of times when we're sleeping, we might be grinding or clenching our teeth and not even realize it. So sometimes you might notice if you wake up with like jaw pain or headaches, that's a sign that you have been grinding or clenching your teeth all night long. Now, a big reason people grind and clench their teeth is because of breathing difficulties. So things like sleep apnea or other breathing difficulties or other sleep conditions, things like insomnia, are all related to grinding and clenching your teeth. So one way to help address teeth grinding is to get a sleep study and get your sleep checked. But another simple solution would be to go to the dentist. And a lot of times people don't even realize that they're doing it because you're doing it at nighttime, so how would you even realize it if you don't have any symptoms? But this is where your dentist comes in. And if they see like signs of you grinding, and usually it's from like wear on your teeth, where your teeth are starting to get worn down and like flatter and shorter, a simple solution is to get a bite guard or like a bite splint. A bite splint is basically like a thicker retainer that just goes over one arch, like either your top or your bottom teeth. And now if you ever grind or clench your teeth, it basically deflects those forces. So it protects your teeth and it protects your jaw, and it can even like prevent things like headaches or jaw pain. All right, mistake number 7 is skipping the dentist altogether. This is also an obvious one, but so many people do it, so I have to talk about it. I'm gonna tell you a motto that I do not want you to follow. No pain, no problem. That doesn't fly with your teeth. Like I said before, minor things in dentistry do not hurt. So cavities and gum disease and bleeding gums usually doesn't hurt at first. But what happens when that gets so big and so bad that it starts to cause an infection or cause a ton of pain? Now you have to go to the dentist. And the worst part is, it's not gonna be a pleasant visit. It's not gonna be like a simple cleaning. It's gonna be an actual procedure. You're gonna be in pain. You're not gonna be happy. And obviously, during the procedure, you're gonna be numb. But the whole process is not gonna be pleasant. This is why it's so important to go every 6 months, go frequently, and get everything looked at so that you can catch something early if there is something. And a lot of times if you do catch something, it's really simple to fix. It's not until you wait for something to get really big and then wait for pain and then go to the dentist. This is when you can start to get some real problems. And I want to go over a little bonus mistake that a lot of people make. A lot of people think it's just inevitable to get dentures. And I don't blame you, because I used to think this too. My grandparents on my dad's side had dentures, and I used to see them all the time growing up. And I would just think like, oh, one day I'm gonna end up having these dentures too. But then I started dental school, I started learning about teeth because that's what we learn about in dental school. And I realized like, hey, I can actually keep these suckers for life. But in order to do that, you gotta take care of them. So anyway, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below. And I will see you in the next video. Have you ever noticed brown stains on your teeth that just won't go away no matter how much you're brushing? Well, what if I told you it could be from something that you had no control of? You see, some antibiotics that they used to give kids back in the day can actually cause permanent stains in the teeth. So in this video, I'm gonna break this down in a super simple way so you can understand if this happened to you,